Good afternoon. Welcome everyone to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang. Here. Senator Nguyen. Here. Senator Titus. Here. Senator Stone. Here. Chair Donate. Here.
Thank you so much. Please note that everyone is present, and we will indicate that in the notes. Good afternoon, everyone. Today we have hearings on Senate Bill 260, 350, 348, 350. Currently, the order that I have the bills are Senate Bill 380, followed by Senate Bill 260, followed by Senate Bill 350, and then Senate Bill 348. So just letting everyone know for today's guidance. Before we start, we do have several housekeeping announcements. As I noted, agenda items may be taken in different order depending on circumstances. This is going to be a very tight meeting, and we expect everyone to please keep to the 2-minute marks. Otherwise, I will be forced to cut you off. We want to make sure that everyone has the ability to speak and so forth, but we do have committee members that have to step out for presentations in other committees later throughout the day, which is the reason why we scheduled it earlier. So please keep to your 2-minute mark. And of course, for the sake of time, we will limit each bill presentation to 10 minutes. We will set the timer for all presentations to not go past the 10-minute mark. And so depending on how the testimony goes, I might cap testimony if I see as we go along. I encourage everyone to please submit their testimony in writing if you're able to do so. It's okay to say ditto for some of these circumstances. And then, of course, you can always submit additional documentation to any of your support testimony. When testifying, please turn the microphones on and off, on to speak and off to listen. And then anyone who wishes to receive additional copies of the exhibits can go to the Nevada Legislature's website. And finally, of course, we ask everyone to please turn off their electronic devices. And because things change very quickly, we'll switch it out to Senate Bill 260 first. This bill revises provisions relating to certain persons providing referrals to group housing for persons who are aged. With us, we have Senator Dondero Loop, so please proceed.
Good afternoon, Chair Donate and members of the Senate Health and Human Services Committee, and I'm sorry if I regrouped the order of things. For the record, my name is Marilyn Dondero Loop, and I represent Senate District 8 in Clark County, and I am pleased to present Senate Bill 260 to you all today. This bill revises provisions relating to certain persons providing referrals to group housing for persons who are aged. I would like to go through the sections of the bill. Section 2 defines the term senior living community to refer to certain facilities or other living arrangements for people who are aged, including residential facilities. Section 3 of this bill defines the term senior living community referral agency as a person who refers individuals to a senior living community. Section 4 of this bill requires all unlicensed senior living community referral agencies to disclose certain information to a person that is aged or the representative of that individual to obtain consent before a referral can be made. This section also requires the Senior Living Community Referral Agency, as defined in Section 3, to 1, maintain a record of disclosure and or consent for at least 3 years, and 2, provide a copy of this record to certain entities. Section 5 prohibits an unlicensed senior living community referral agency from referring a person who is aged of the representative of such person under certain provisions. This section also requires an unlicensed senior living community referral agency to establish a policy that protects the privacy of the aged person and their representatives, preventing the selling of their personal information. Additionally, this section requires an unlicensed senior living community referral agency to stop contact and or referrals for an aged person or their representative upon request. Chair Donate, I have some phone friends with me, so I would like them to introduce themselves and answer any questions that you may have. Thank you very much.
Good afternoon, Chair Danyate. I am Ashley Cruz with Career Nevada for the record. With us is Jim Rosenthal representing Caring.com and A Place for Mom to talk a little bit about why we think this bill is important. We're also available for any questions. Thank you.
Good afternoon, Chair Donyate and members of the Health and Human Services Committee. Thank you for having me here. I'm Jim Rosenthal. I'm the CEO of Caring.com. Nevada is currently the only state that operates exclusively on a subscription fee structure, requiring senior living communities to subscribe to referral agencies like us and pay a subscription fee whether we place a senior in a community or not. This model harms many of the communities that care for our seniors. By charging a subscription, the current law creates instances where a community pays for a service it rarely or never uses, which can price some of the smaller communities out of the market. The result is that some of these smaller communities choose not to use our services, sometimes making it hard for us to help families find the best community for their loved ones. The goal of SB 260 is to align the interests of the three parties involved. 1, the senior and family, 2, the referral agency, and 3, the senior living community, to ensure that the senior ultimately moves into the community that is best fit with the senior's needs and wants. We're convinced that optimization happens when we're able to charge communities on a move-in basis. It's worth noting that all of our services are free to the families and seniors we work with. This pricing change, along with many of the consumer protection provisions outlined in SB 260, protects some of our most vulnerable population, along with the communities they are joining. I'm happy to answer any questions you may have.
Thank you so much. Any questions from any committee members? Senator Titus?
So thank you, Mr. Chair, for the questions, and thank you for being at the table. And Senator, thank you for bringing this forward, because I think it's a real need in our state. Having been long-term care medical director for many years, I've had contact from families throughout this nation on what to do with mom. And when I've had a patient, what do you do? It might be a dad, though, so I know that you use mom, but there are dads that need placing sometimes. But would you explain actually what you do? So as far as you don't administer any care to patients, correct?
Correct. We're a referral agency, so we spend time.
Name for the record, please.
Sorry?
Name.
Oh, I'm sorry. I'm Jim Rosenthal. That's correct. We don't provide the care. We refer people after learning about their wants and needs of the senior, and then we look for communities that are a good fit with those wants and needs, talk to the family or the senior about them, and if there seems to be a fit, we get their consent to share their information, and then we share it with both the community and with the family. And we continue to nurture both sides to find the best fit for the senior.
And so that final decision process is still, you just are service to the family or the individual to find the location, then you kind of pair them up. It's almost like you are a matchmaker type of thing. And so you find the match, right? And then it's up to the family to make that final decision if it's an appropriate location, correct?
Yeah, Jim Rosenthal, correct. They very few people move in if they don't tour a community, so the next step is typically to set up a tour and to tour the facility, and then they'll continue to work together and see if both there's a fit and if the community can service their needs and their wants.
And then
we stay involved and nurture both sides.
And you're
But
reimbursed by the facilities they move into?
we are, well, only in Nevada are we not reimbursed on a move-in, but yes, we are paid by the communities currently throughout Nevada on a subscription basis.
Right.
But in the 49 other states, we aren't exclusively subscription.
Great, thank you.
Chair Donate, if I could just add a personal note right here. Unbeknownst to me, when I started this bill many, many months ago, my sister-in-law had used this service for her father, and it was because when they found a place for him to begin with, his needs changed. His cognitive abilities and his medical needs changed. And so they needed to find a different position for or place for him. And so that this process helped her match that for her father they had to move him, and of course that was traumatic as well. Thank you.
So, and just final question, are there other referral agencies out there other than yours?
Yes, there's both national referral agencies that tend to have an internet model, and then there's local referral agencies, which are, similar to like a local real estate agency.
All right, thank you. Thank you for the question.
Jim Rosenthal, sorry.
Thank you so much. Senator Stone.
Thank you, Mr. Chairman, and I want to thank Mr. Rosenthal for coming in and kind of explaining how the program works here in Nevada. I'm in complete support of what you're trying to accomplish, I think, here today, but just a couple of questions. We talked about matchmaking. What happens if the match doesn't go well? What if a patient doesn't like living in the new environment that they're living in? And what are the cancellation provisions? And number two, what if a patient has a deteriorating medical condition where they need more medical help and need to go into a more medically serving facility? How would a family do that?
So, Jim Rosenthal, it happens a lot often. Seniors, their needs and wants change, especially their care needs. And typically the community they're in, the senior living community, is on top of that and is very helpful in finding them a new place. We will get involved if asked. We don't follow up and say, how about you move into another place? Because we actually don't know exactly what's going on in the community. But so the communities take the lead on that, but we're always standing by ready to help.
So does the patient, if I could follow up, does the patient or the patient's family, do they sign a rental agreement or a lease agreement with the facility that you help effectuate? And can that be broken if a patient just subjectively doesn't like the care they're receiving for whatever reason? They've taken a tour, I know they like the facility. What if they have issues? How easy is it for a patient or a family to cancel and say, I want to go find someplace else? And we know seniors, sometimes if they have a little bit of dementia, maybe they like what they see today, but they may not like it tomorrow. How do you deal with situations like that? Jim
Rosenthal. So yes, they do sign, the family and the senior sign no contractual agreement with us, the referral agency. They do sign a residential agreement with the community that they choose to move in with. The ones that we're familiar with and the partners that we're aligned with make it relatively easy to move out.
Okay.
It happens all the time.
Okay. I just want to make sure there was no recourse if a patient doesn't have their needs being met, that the fee that you're being paid is being charged to the patient because they want to move out prior to the period of the lease of which they've signed on to.
Yeah, and Jim Rosenthal, I should add that in the other 49 states where we are allowed to charge on a move-in basis, when that happens, our fee gets significantly reduced. It's called a respite fee. So the industry is entirely set up for that to happen, and we, as are we.
Thank you so much. Any other questions? That concludes our presentation. Let's move on to testimony. If folks that would like to provide testimony in support for Senate Bill 260, if they can please make their way forward to the dais, or anyone in Las Vegas. Once again, anyone in support of Senate Bill 260? Anyone in Las Vegas? And anyone virtually?
If you'd like to testify in support on SB 260, please press star 9 on your phone to take your place in the queue. Chair, there are no callers for support at this time.
Thank you so much. Let's move on to opposition. If there's anyone here in opposition to this bill, please come forward.
Mr. Chair, members of the committee, for the record, my name is Brett Salmon with the Nevada Healthcare Association. We represent the assisted living and nursing facilities discussed previously. As we understand the bill, it would allow a referral agency to operate without a license in Nevada. It does add several requirements to these companies, but it appears there would be no statutory or regulatory oversight by the state of Nevada of these companies, and we feel that this type of model does not protect consumers who ultimately become our residents. However, having said that, we've had 2 really productive conversations with the proponents of the bill and look forward to future productive conversations with them. So thank you.
Thank you so much. Anyone else? Anyone in Las Vegas? And anyone virtually?
If you'd like to testify in opposition on SB 260, please press star 9 on your phone to take your place in the queue. Chair, there are no callers for opposition at this time.
And anyone willing to testify in neutral on Senate Bill 260, please come forward. Anyone in Las Vegas? And anyone virtually?
If you'd like to testify in neutral on SB 260, please press star 9 on your phone to take your place in the queue. Chair, there are no callers for neutral at this time.
Thank you so much. Any closing remarks? No? All right, I'll go ahead and close the hearing on Senate Bill 260. Is there a motion to move forward with the bill?
I would make a motion to, there's no amendment, right? Just do pass.
Nice, enthusiastically second the motion.
Thank you so much. We have a motion to do pass by Vice Chair Nguyen, seconded by Senator Stone. Any discussion? Senator Titus.
Yes, thank you. There, per expression about documentation and licensure, to have a business in the state of Nevada, like a legal to confirm that they would have to have a license to do business in the state of Nevada, correct?
Eric Robbins, LCB Legal, for the record. Yes, to the same extent as any other business, they
correct.
would have to have a license.
Thank you.
Thank you so much. Any questions on the motion to do pass Senate Bill 260? Any discussion? All right, moving on to the vote. All those in favor, please say aye. Aye. Any opposed? Any abstentions? The motion is carried, and we'll go ahead and assign this to Senator John Darrell for the floor statement. Let's move on to Senate Bill 380. I will go ahead and open the bill hearing on this. This bill revises provisions relating to the Extended Young Adult Support Services Program. We have with us Senator Nguyen, so please proceed when you're ready.
Good afternoon. It's my pleasure to present Senate Bill 380, which pertains to extended foster care programs throughout the state of Nevada. I'm sorry, for the record, my name is Rochelle Nguyen, and I represent Senate District 3. Extended foster care programs allow youth to retain in or re-enter care beyond their 18th birthday. This critical resource allows young people to gain more time to develop critical life skills, relationships, and resources that can help them thrive as adults. In 2021, the legislature passed Senate Bill 397, which allows agencies that provide child welfare services to establish extended foster care programs pursuant to Federal Fostering Connections to Success and Increasing Adoptions Act of 2008. Specifically, Senate Bill 397 enabled the continuance of a legacy state program regarding extended foster care entitled Step Up, while the state and relevant jurisdictions explored a pilot program to access available federal dollars with the ultimate goal of transitioning to a complete federal funding, should the program prove to be beneficial. At the request of the stakeholders, which included the state of Nevada, Clark County, and Washoe County, I have sponsored Senate Bill 380, which is before the committee today. Fundamentally, and on a very high level, the legislation extends the effective date of the program to July 1st, 2025, to give those stakeholders more time to implement this important program, and make several changes necessary for the implementation of the program that were not originally contemplated in the legislation from the 2021 session. There is a proposed amendment that was filed by Clark County. That is a friendly amendment. It has some additional language about the effective date or the extension of that date to the July 1st, 2025 date. Additionally, there's a new reporting section in Section 1. I think we all know that accountability is key in this building, and so there are some provisions because I know since the passage of the original legislation, Senate Bill 397 in the 2021 session, we had a hard time getting everyone together and getting this program, hence the reason for this extension. And so we believe some of these accountability provisions will make sure that we have some legislative oversight to make sure that we are going forward with that. I do have Joanna Jacobs here with me from Clark County to answer any questions that the committee might have.
Chair Donati, I wanted to thank Senator Nguyen, Joanna Jacob, Government Affairs Manager for Clark County, for the record. I wanted to thank Senator Nguyen for working with us. The amendment, I just want to give one more additional clarifying record, is that in the interim and recently, we've been partnering with the state of Nevada and Washoe County on how do we draw down some federal funding to support some of our child welfare programs. Earlier this week, you passed out a bill. I know this has been thank you very much for doing so. This has been a topic that we've been monitoring. So the intent of the amendment is really to reflect what we've learned from the state of Nevada's communication with the federal government, in that we cannot partially implement programs, that we have to do everybody all together, all at the same time, to start billing 4E. And so to do so, there's some very critical things that we need to do to really extend not only 4E eligibility in our extended foster care program, which is known as our Step Up. It's been in program, and it has been in existence for many years. This bill is not ending Step Up. Step Up continues. What we're trying to change is how we pay for it. And that is really the intent. We need to, if we want to make that federally reimbursable, we also need to do several key and important things, which includes extending kinship, guardianship assistance payments to age 21, adoption subsidy payments, wherever the children are at the age of 18. If we're going to extend it to age 21, everything needs to go together. And that's our understanding from the state of Nevada and their communications with the federal government. So that's really the intent of the bill. There is an option in here, and you'll see in the amendment that we've removed the caveat for just counties over 100,000. That is because we are going to work with the state to have this extended for not only the children in Clark and Washoe, but also for the kids served by the state of Nevada in our rural region. So everybody all together, all at once. And the reporting is really going to make sure that we can keep the legislature informed, because it will be a policy shift. And we think it's important to stay in communication with the Interim Finance Committee as we head into the next legislative session. So that's the end. I know we're hopefully did not muddy it up too much, and we can definitely answer questions.
And Rochelle Wynn, for the record, I know that there were some questions initially about why our rural community, why there was that population cap. And initially, the initial legislation contemplated, it really just affected that. But I think in these conversations that we've had, we've realized that we could also pull down some of those federal dollars for our rural communities throughout the state.
Thank you so much. Questions, Senator Titus?
First, thank you, Mr. Chair, for the questions, and second, thank both of you, because I was the one who brought up why the pop cap here. Would it be available in the rural areas? So I appreciate your hearing my concerns about that. My next question, actually, though, is according to this, so if you're going to extend some of the services past the age, and I agree with that. I mean, I think at 18, suddenly these kids were finding themselves, what do we do now if they didn't have that support? But I also want to make sure that these funds, the child has to sign, and at 18, they're an adult. They have to be a component of this extension, correct? So they have to make sure the money goes to them and not a foster parent that doesn't have anything to do with them any longer. I mean, I just want to make sure that any extension follows the person.
Joanna Jacob, for the record. I think we're talking about several things. So to answer your question, in our Step Up program right now, usually the children enter into it. It's an agreement. The child agrees, and it's kind of like they get a level of supervision with the court. It's called voluntary court supervision. So there's oversight by the court, but they're served through Clark County's social service department. So they come out of family service, and I think this is the way it works in Washoe County too. They come out of family services, go into social services. So that is really something that's been in place in the state for a long time, and it predated some of the conversations at the federal level about extending foster care. So when we're talking about extending foster care, though, when I talked about all of the other things that need to go along with that, what a decision that the state will have to make, and we'll be reporting to you at the Interim Finance Committee about, is if we have a child in a foster home and there's foster payments that are associated to help support the foster parents, that too would have to be extended up to the age of 21. So the money is basically there to wherever the child is and however they're being served. And there is federal money available for this that can help defray some of our costs really for all of those programs. And that's really where the federal policy is going.
And just for the record, Rochelle Wynn, this is a perfect example of where we were able to, in this legislative body, our former colleague, Barbara Buckley, had the foresight to establish this type of program that later on the federal government realized that this is a great thing that we're seeing happen in the states. And now we're trying to catch up to some of that money that is now available federally.
Any other questions, Senator Stone?
Thank you, Mr. Chair. Appreciate the opportunity. And I want to thank you for your presentation, Ms. Jacobs, and thank you, Senator Wynn, for bringing us forward. As a former county supervisor in the 10th largest county in the country, I'm very much aware of what happens when a foster child reaches 18 and has nowhere to go. And unfortunately, they usually find themselves, in many cases, in the criminal justice system, as they're not prepared for many types of jobs or any independent life skills. So I'm 100% in support of what you're trying to do. I think we should do whatever we can to leverage federal funds, not only here but through Medicaid. We've had other discussions. So, with respect to Clark County, how many more kids do you think you would be able to help getting the federal funding that you hope to receive in 2025, assuming that the synchrony that I think you're talking about actually comes to fruition?
Joanna Jacob for the record. Senator Stone, I will get that number for you. I don't have those numbers here today. I will tell you, we have, and you're very fortunate, you represent Clark County. The kids that are in Clark County are supported through this, as Senator Wynn noted, with the foresight of our former speaker, Barbara Buckley, to have this program. They're in school. We're supporting them as they're going to college, they're working, those kinds of things. I can tell you we have, I think it's maybe about 287 kids right now in this program. We've also started some other programs to support this aged out youth. So I'll try and get you those numbers. I don't know if we could forecast how many more that we could. The shift that we're going to do, that we're talking about over the interim, will require additional resources at the county level, which is why we're trying to report to the interim finance committee, because we're going to have to work on it, maybe additional staffing as we move to serving those children. And really we're talking about everybody who's in foster care, that it will just end up supporting them regardless of where they are being served today, up to the age of 21. So I can work on that projection, certainly can help.
Please don't spend a lot of time on it. I was just wondering, and just the amount of money that you think that the federal government is going to give, is that going to be 100%, or is that going to be still a county shared project?
Joanna Jacob for the record. Thank you for that question. No, it's not 100%, but it does, I think it depends, and I'm going to give you an estimate with the caveat that I'll try and get that correct. But on average, 4E really covers, I think, about 30% of those costs, meaning we'll try and defray the general fund costs. We'll try and bill what we can to the federal government. I think that's a very prudent thing to do and something this body has supported, right? And so I think that it's not 100%. And as that federal policy develops, we might see that percentage change, but it's on average about 35% of the cost.
Thank you. And again, thanks for presenting the bill. I fully support it.
Thank you so much. We don't have any further questions, so we'll move on to testimony and support. So anyone that would like to testify in support for this bill, please come forward. Again, we'll put the 2-minute mark. And Mr. Norman, we'll begin with you.
Chair, members of the committee, thank you. Jonathan Norman, Nevada Coalition of Legal Service Providers, NORMAN. We represent, between Northern Nevada Legal Aid and Legal Aid Center Southern Nevada, 3,000 to 4,000 kids in foster care at any time. I was a CAP attorney, so that was my job before moving into policy. And, I still have a handful of cases, and a lot of those, I don't have a lot of cases because this is a full-time job, but I kept the kids who were 18 to 21 because they'd been with me for so long. And that program really is vital, and I look forward to the effort to tap into 4E funds so that we can further serve our foster kids in the state, whether that's through adoption subsidies, kin gap subsidies, or the kids who age out. So I appreciate the senator and Ms. Jacob from the county. Thank you.
Thank you so much. Anyone else wishing to provide testimony and support? Anyone in Las Vegas? And anyone virtually?
If you'd like to testify in support on SB 380, please press star 9 on your phone to take your place in the queue.
Good afternoon. My name is Deshaun Jackson. I serve as the Safety and Welfare Policy Director with the Children's Advocacy Alliance. As a former foster youth, I understand the importance of extending foster care to the age of 21. So I'm so excited that this is moving forward. The Children's Advocacy Alliance stands in support of SB 380, and we are so thankful to the bill sponsor and to the state as a whole. So thank you so much.
Caller with the last three digits, 736, you are unmuted and you may proceed.
Hi, this is Kara Polly calling on behalf of Washoe County Human Services Agency. Washoe County is supportive of SB 380. We're supportive of it submitted with the amendment, and we appreciate the Senator's willingness to allow us to work on some changes so there could be a unanimous child welfare voice across Nevada. We look forward to the work we have ahead of us and the future to make this program come to fruition. Thank you.
Chair, there are no more callers in support at this time.
Thank you so much. Let's move on to opposition. Anyone in opposition to this bill, please come forward. Almost had me. Anyone in Las Vegas and anyone virtually?
If you'd like to testify in opposition on SB 380, please press star 9 on your phone to take your place in the queue. Chair, there are no callers for opposition at this time.
Thank you so much. And anyone willing to testify in neutral on this bill? Anyone in Las Vegas and anyone virtually?
If you'd like to testify in neutral on SB 380, please press star 9 on your phone to take your place in the queue. Chair, there are no callers for neutral at this time.
Thank you so much. At this time, I'll go ahead and close the hearing, and we'll wait for Vice Chair Nguyen to get back. Yep. Senator Titus?
Yes, thank you, Mr. Chair. I would like to move that we go ahead and work session this bill.
Second.
Thank you so much. So we have a motion to amend and do pass from Senator Titus and a second from Senator Stone. Any discussions on the motion? Any questions? Moving on to the vote for amend and do pass. All those in favor, please say aye. Aye. Any opposition? Motion carries, and I'll assign that floor statement to Vice Chair Nguyen. Let's move on to our next agenda item, Senate Bill 350. This bill revises provisions relating to graduate medical education. With us, we have Senator Pazina. So welcome to Senate HHS, and please begin when you're ready. And while they're getting ready, I just want to give a shout out to the school public health students that are here joining us for our presentations today.
Good afternoon, Chair Danyate, Vice Chair Nguyen, and members of the Committee on Health and Human Services. For the record, my name is Julie Pazina, and I represent Senate District 12 in Clark County, and I'm proud to be here today to present Senate Bill 350 before you. As you know, we're facing a shortage of medical professionals in Nevada. As such, this bill aims to expand graduate medical education opportunities, including residency and fellowship programs, in the state to ensure that Nevada medical school graduates and physicians stay in Nevada to practice medicine after their residencies or fellowships. On a personal note, when I had the opportunity to meet with my neighbors on doors, not just this past year, but in many years before, I've been knocking doors for many years here in Nevada, one of the things that really struck me was neighbors crying on their doorsteps, telling me stories about how their child, their spouse, their parent, their partner was unable to get into a doctor, not only for weeks, often months, and for specialty physicians even longer. And that's the genesis of this bill. With the chair's permission, I'd like to go through the bill section by section. Section 1 of Senate Bill 350 amends Chapter 223 of the Nevada Revised Statutes to include Sections 2 through 6 of this bill. Section 2 creates the account for the Graduate Medical Education Grant Program in the State General Fund and requires the directors of the Office of Science, Innovation, and Technology, otherwise the office, and the Office of the Governor to administer this account. Additionally, Section 2 requires the money in the account to be used to award competitive grants to institutions in this state pursuant to the program. Section 3 of this bill creates the Advisory Council on Graduate Medical Education and outlines who will make up the Advisory Council, how they'll be compensated, and how long each member can serve along with other guidelines. Section 4 requires the Advisory Council to evaluate applications for competitive grants for the program and to make recommendations to the office for approval as established in Section 5. Additionally, Sections 4 and 5 require the Advisory Council and the office to give priority to applications for grants made for the purpose of the creation, expansion, and retention of residency training and fellowship programs. Section 6 requires the office to submit an annual report to both the governor and the legislature with any recommendations for the measures to create, expand, and retain the program. Sections 7 and 8 require the director to provide the necessary support for the Advisory Council and to implement the program. Additionally, these sections clarify that the money for the program is required to be deposited into the account. Section 9 makes an appropriation from the State General Fund to the program. And lastly, Section 11 provides that this bill is effective upon passage and approval. Please note the proposed amendments that may be found in Nellis. In Section 3, Number 6, we've added language regarding the frequency of meetings based on making timely grant recommendations. In Section 4, Number 2B, an emphasis is placed on the healthcare needs for the state. Finally, in Section 9, Number 2, we propose that the grant money be reverted to the Graduate Medical Education Grant Program for additional GME grant expenditures. Senator Titus and I have been working together closely on funding and policy for graduate medical education, and we'd really like to incorporate elements of Senate Bill 350 and 369 together to ensure sustainable funding for graduate medical education in the state of Nevada. And with that, I'd like to hand it over to my friend, Dr. Timothy Baker with the University of Nevada, Reno School of Medicine. We also have someone, as you can see at the table, who will be presenting, Jesus Medrano with HCA Healthcare Division Vice President of GME in Las Vegas. Thank you.
For the record, Timothy Baker. Thank you, Chair Dunyate, Vice Chair Wynn. As I said, my name is Timothy Baker. I'm the Senior Associate Dean for Academic Affairs at the University of Nevada, Reno School of Medicine. I oversee the Office of Graduate Medical Education, which manages all residency and fellowship programs sponsored by our School of Medicine. I'm also a primary care internal medicine physician. I want to thank Senator Pezzina for bringing this important bill forward. As she mentioned, any patient who's had to wait months for an appointment will certainly tell you Nevada needs more doctors. Having public medical schools, both here in Reno as well as in Las Vegas, and residency and fellowship programs here in the state has been shown to be successful in keeping our homegrown physicians in Nevada. With nearly 40% of students who attend one of our public medical schools stay here in Nevada to practice. 55% of those who complete residency or fellowship stay here in Nevada to practice, and more than 3 of every 4 physicians who complete both medical school and residency in Nevada stay here to practice. This data clearly demonstrates the powerful additive effect of having both public medical schools as well as residency and fellowship program training programs within the state. And we work closely with the University of Nevada, Las Vegas School of Medicine on all of these initiatives. To train more doctors, though, requires long-term commitment. ACGME, or Accreditation Council for Graduate Medical Education, accreditation requires that programs have sustainable funding. If sustainably resourced, a training program will last indefinitely, continuing to create doctors that can care not only for us, but for future generations of Nevadans. I would end with just my personal experience. I graduated from the University of Nevada, Reno School of Medicine, and I had an opportunity to stay here for my training in internal medicine. But my wife, who was pursuing pediatric training, did not. So we did not have a pediatric residency program. So we were essentially forced to leave the community to ensure that we got the training that we needed. Now, we're the exception in that we came back after training elsewhere, but we do much better when we teach them here in Nevada at our state medical schools and when we train them here in Nevada. Each residency program, each fellowship program that we do not have is a missed opportunity to keep our own students and grow our own doctors here in Nevada. And Senate Bill 350, with its emphasis on the growth of residency and fellowship programs, is an excellent and positive first step toward achieving this. Thank you.
Thank you so much, Dr. Julie Pizzina, again for the record. And I would like to bring it back down to Grant Sawyer Building. And I believe, and I'm not sure if it was Jesus Medrano or Dr. Angelina Rodriguez, but one of them will be presenting for us from HCA on the importance of GME. Chair, with your permission, we'd like to proceed. Thank you.
Thank you, Chair Donata and members of the Senate Health Committee. My name is Dr. Angelina Rodriguez, Angelina Rodriguez. I am the designated institutional official of our HCA Healthcare Sunrise Health Graduate Medical Education Consortium, also known as Sunrise Health GME. I'm speaking on behalf of Jesus Medrano, our VP of Graduate Medical Education for HCA Far West Division. I oversee the accreditation of all the resident and fellowship programs at Mountain View Hospital and Sunrise Hospital and Medical Center here in Las Vegas. Sunrise Hospital is also part of our Graduate Medical Education Consortium. We are in support of SB 350 and appreciate Senator Pizzina's diligent efforts to expand graduate medical education in Nevada, including both residencies and fellowships. This past March 17th was Match Day, the day where graduating medical students learn where they will be spending the next several years as residents and fellows. At Sunrise Health GME Consortium, we matched 109 new residents to join the 279 current residents based at Mountain View Hospital and Southern Hills Hospital and Medical Center. This is good news for Nevada because statistically more than half, 54.6% of these residents will stay in Nevada. However, there is tremendous opportunity to do more. Our programs received a substantial amount of applications for a limited number of positions. For example, our anesthesiology residency program received more than 1,000 applications for just 8 positions. Diagnostic radiology received more than 400 for 5 positions, and physical medicine and rehabilitation, the only program in Nevada, received more than 400 for only 6 positions. This year, for a July 2023 start, we've received ACGME accreditation for pain medicine in coordination with the Department of Veteran Affairs and infectious disease fellowship, both the first in the state and neither of which are CMS funded. Given the interest, I'm confident that if we build the slots, the residents and fellows will come and they will stay. Unfortunately, our facilities are now past their CMS resident slot cap building period of 5 years, so getting new programs off the ground is challenging. Grants such as those contemplated in SB 350 can get subspecialties off the ground since it costs up to $150,000 per resident to cover costs, including salaries, benefits, training, and administrative support for an accredited program. SB 350 invests in GME with a focus on Nevada's most needed specialties. In addition, following this funding to help start up fellowship programs will allow us to invest in subspecialty training that is desperately needed in Nevada. Thank you for considering SB 350. We look forward to continuing to work with Senator Pizzina and this committee to appropriately invest in the development of our healthcare workforce. I have Dr. Kate Martin also here with us.
Unfortunately, we're going to have to cut the presentation off because we have reached the 10-minute time limit that we've allocated for the presentations. But I think this, Senator Pizzina, if you're okay, we can move on to questions? Okay, thank you. Senator Titus?
Thank you, Mr. Chair, for the questions. Thank you for bringing the bill forward, and thank you for the continued conversations that we have had. Absolutely think that moving forward is the key here. And not to give a plug to my particular bill, I'm concerned, but I am, but I'm concerned that you've asked for a set fund of $17 million, and I'm on Money Committee, so we'll see this bill again. How far will that go? How many residency slots will that actually achieve?
Thank you, Senator Titus. Julie Pizzina for the record. One of the reasons I think we've been working so closely together is because of the sustainability and the importance of the funding. So working between Senate Bill 350 and 369 and looking at the opportunities with establishing a credit against the modified business tax, we can ensure that this money is a lot more sustainable. So I think one of our concerns is it takes a little time, as you know, to stand up a fellowship program. So by the time we get that stood up in 3 to 4 years, it's important that we have money that's sustainable and can move forward. It's the reason for one of the amendments as well that we brought, asking for the money to revert back to the fund as opposed to going to the general fund afterwards in Section 9 to Section 9.2. We'll be able to stand up a number of programs. The challenge will be fellowship programs specifically, and that's why melding our bills and working together, I think, is so important.
Great, thank you for that. And so that's what I see also is just the sustainability. But again, the Las Vegas testimony was it was about $150,000 to stand up a resident. Is that per year per that resident or the 3 years of, say, a residency training? So,
Angelina Rodriguez here for the record. That is $150,000 per year per resident.
right. So simple math I can do and knowing how far this can go. And so what happens if the residency program starts, if I might continue, Mr. Chair, and doesn't get the accreditation?
Timothy Baker for the record. I can defer to Las Vegas if you'd prefer.
Thank you. Angelina Rodriguez for the record. We cannot move forward with the programs if they are not ACGME accredited.
And do you have a certain amount of time? Because again, that 5-year, I'm worried that it may take sometimes longer than 5 years. So looking forward to moving this bill and making sure that it's sustainable. And thank you for bringing it forward. Thank you for the question.
Thank you so much. Any other questions? Senator Stone.
Thank you, Senator Pizzina. I appreciate you bringing this forward. I heard this when I was walking as well. We have a shortage of specialists here in Nevada and primary care doctors as well. So, Dr. Rodriguez, thank you for your testimony. And you mentioned that 54.6% of those that are trained here are going to stay here. So, I don't know if it's going to be this advisory committee that's going to be answering the questions I'm going to ask now, but what is our strategy other than to provide the residencies to kind of have the doctors have some obligation to stay here in Nevada? I want to make that percentage obviously higher.
Angelina Rodriguez for the record. Yes, I agree. Huge initiatives with boots on ground, not only for HCA, but for all of my colleagues in graduate medical education, is to train and retain these graduates, these learners. And great efforts and strategic plans are in place and to continue to improve that number, because we agree as well, we want that number to continue on the upslope.
Thank you.
And Senator Stone, just to further answer your question, Julie Pizzina for the record, my understanding as well is that more than 3 in 4 doctors who graduate in the state and then do their graduate medical education in the state will stay here. So I think a huge emphasis is going to be looking on those doctors that graduate in Nevada to be placed into these programs.
No, and I love that statistic, and I know the statistic across the country is about 70% of residents that go to a particular area usually end up staying there. And I really appreciate the fact that we now have an infectious disease residency program on the way, pain med program on the way. As a part of this committee that's being formed, is there going to be a prioritization of specialties that we don't have in Nevada and not duplicate residencies for specialties that we do have? Pediatric oncology, sir, Dr. Baker, is one that's of concern to me.
Julie Pizzina for the record, and I'm also happy to defer to the experts as well. But yes, the reason that we really placed an emphasis on having this stand up for 4 years instead of just the 2 years we typically fund on the biennium is so that we can prioritize those fellowships as well for the specialty education for specialty physicians. And in speaking with deans of UNR, of UNLV, of Roseman, of Touro, one of the things we discovered as well is the importance of having them on that advisory committee as well, so that they can help share some of the needs of the state along with doctors who are working at hospitals around the state. We've also engaged the rural communities as well in this discussion to try to engage specialties in those areas as well.
I appreciate that. Thank you very much.
Thank you so much. That concludes our round of questions, so we'll move on to support testimony. We're going to be capping support, opposition, and neutral to 15 minutes, so we encourage everyone to please shorten as you can so that everyone has the opportunity to speak. Mr. Kane, we'll start with you.
Thank you, Chair Doñate. Chair Doñate, members of the committee, my name is Connor Kane, and I'm here to testify in support of SB 350 on behalf of Touro University, Nevada, which is a private, nonprofit medical school that graduates 180 future doctors every year. We're grateful to the sponsor for her diligent work on this bill, engaging us and other stakeholders well in advance of this legislative session. As you've heard, investing in graduate medical education is essential for us to keep medical school graduates here in Nevada to practice where they are desperately needed. All of our state's medical schools are graduating excellent physicians, and we urge your support of SB 350, which will help to keep them in Nevada. Thank you.
Good afternoon, Chair Donate and members of the committee. For the record, my name is Trevor Parrish, and I'm the Manager of Government Affairs over at the Vegas Chamber. The Vegas Chamber is in support of Senate Bill 350 because of the importance that it places on graduate medical education. As Las Vegas currently ranks at the bottom of the list of physicians per capita and healthcare delivery systems, it is important to increase the state's focus and investment in graduate medical education. The Chamber supports efforts to invest and expand graduate medical education throughout the state. We believe the creation of the Graduate Medical Education Grant Program, it reinforces the state's role in these efforts. This program will award grants to Nevada's institutions of higher education that wish to expand or create residency programs, which is an important investment in our healthcare system. The more medical residencies that we offer in Nevada, the more likely that those doctors will stay here and practice medicine. We also believe the creation of the Advisory Council on Graduate Medical Education will help improve our efforts to increase physician capacity. Their expertise and knowledge will be essential to our success in these endeavors. That is why it's important to leverage state funds and efforts to expand our capacity of medical students at our private and public medical schools. Our goal is to have a stronger healthcare system for our employers, employees, and families. Thank you for your time and consideration in supporting Senate Bill 350.
Thank you, Chair and members of the committee. For the record, Katie Ryan with Dignity Health St. Rose Dominican, here in support of SB 350. Just wanted to go on the record to thank the bill sponsor for this great piece of legislation and also for working with Senator Titus to combine the bills. At St. Rose, we have 2 GMA programs currently, one internal medicine and one family medicine, and we're really looking to grow that, obviously into fellowships and et cetera. So just very excited that you guys are going to put the infrastructure in for that. Thank you.
Good afternoon, Chair Doñate, members of the Senate Healthcare Committee. We urge your support for Senate Bill 350. We would like to thank Senator Pezzina for bringing this forward and including UNR as well as the other institutions in this discussion. We think this bill will go far in terms of the expensive efforts to increase our healthcare workforce. Thank you.
Thank you so much. Ms. Martinez, you'll be the last one before we go to Vegas, and then virtually, and then we'll come back.
Thank you, Chair. Good afternoon, Chair Donate and members of the committee. For the record, my name is Susie Martinez, and I'm the Executive Secretary Treasurer of the Nevada State AFL-CIO. And on behalf of over 150,000 members and 120 unions, we are in full support of Senate Bill 350. Thank you.
Thank you so much. Let's go to Las Vegas. Those willing to testify in support.
Hi, my name is Dr. Kate Martin. I'm the Associate Dean for Graduate Medical Education and the designated institutional official for the Kirk-Kerkorian School of Medicine at UNLV. I'm a lifelong Nevadan, and like Dr. Baker, I'm also a graduate of the University of Nevada School of Medicine, and I'm a primary care physician. I am here today to speak in support of Senate Bill 350. As you heard, year after year, the state of Nevada remains at or near the bottom of national rankings for active physicians per capita, whether it's specialists or primary care doctors. UNLV has made progress starting new programs in graduate medical education, as well as expanding existing residency programs to address the physician shortage issue. Funding for our new programs and expansion efforts has largely come from grants awarded by the Nevada Governor's Office of Science, Innovation, and Technology. SB 350 would provide the statewide infrastructure and sustained financial support to help us meet the healthcare needs of our growing communities. Half of our residents are leaving the state when they graduate, many to pursue advanced training or fellowship programs that aren't currently offered in Nevada. SB 350 helps solve this problem. Thank you for your time, and I'd be happy to answer any questions.
Thank you so much. Anyone else in Las Vegas willing to testify in support? Let's move on to virtually. VPS, is there anyone virtually in support?
If you'd like to testify in support on SB 350, please press star 9 on your phone to take your place in the queue. Caller with the last 3 digits, 951, please press star 6 to unmute yourself. Caller, you are unmuted.
Good
and you may
afternoon,
begin.
Good afternoon, Chair Donate and members of the committee. My name is Sarah Watkins, and I represent the Nevada State Medical Association. The Nevada State Medical Association is the oldest and largest Nevada physician and patient advocacy organization in the state, and we are in full support of SB 350. We support this bill as we support any bill that increase efforts and avenues that enhance the graduate medical education programs in Nevada. An expansion of graduate medical programs will create a growth of physicians in Nevada that will in turn create more access to care to patients in this state. We thank you very much, and the bill sponsor and members of the committee.
Chair, there are no more callers in support at this time.
Thank you so much. Ms. Bossi?
Thank you, Chair Donate and committee members. My name is Chris Bossi. I'm representing Renown Health today. Very brief comments. As the academic affiliate partner with UNR Med, we are here today in significant support of SB 350. We appreciate Senator Pazina's putting this bill together and bringing it forward. As an academic affiliate with UNR Med, our GME programs have lots of opportunity to grow. If we can identify resources, it'll go a long way in growing our programs. So we're in significant support. Thank you.
Hello, committee. Elise Monroy Marsala. I'm here today on behalf of the Nevada Public Health Association and the Primary Care Association. The Primary Care Association is the member organization for the state's community health centers and federally qualified health centers, and we support, NVPCA supports any and all initiatives to support the workforce. Actually, earlier this session, we were proud to support Senator Titus's bill, Senate Bill 369, as we believe that these two efforts together will continue to grow. We'll hope to grow the workforce for physicians in Nevada. Thank you.
Thank you, Senator Dan Musgrove, representing the Valley Health System of Hospitals. We are statewide. We have an incredible relationship with Touro University. We have approximately 160 residents right now and hope to grow that another 80 more. To Senator Stone's question, we do residencies in internal medicine, family practice, general surgery, psychiatry, ortho, pulmonary, neurology, and emergency medicine, and hope to go into OB at some point. So we support this bill and thank the senator for bringing it.
Kent Irvin for the Nevada Faculty Alliance, the independent statewide association of professional employees at Nevada's public colleges and universities. We work to empower our members to be fully engaged in our mission to help students succeed. SB 350 will provide more opportunities for our medical graduates, and it will help reduce the provider shortage in Nevada, which makes it hard for our members to get the health care they need for themselves and their families to stay productive and engaged. Thank you.
Mr. Chair, members of the committee, Constance Brooks, for the record, representing the University of Nevada, Las Vegas. I want to echo the sentiments of Dr. Martin, our GME Dean for the Kirk Kerkorian School of Medicine, but I also want to applaud the efforts of Senator Pazina, one, for listening to her constituents and bringing this bill forward, but also for the inclusive nature in which she went through for the bill development process. We appreciate her inclusion of Dean Kahn, who is the Dean of the Kirk Kerkorian School of Medicine, and also the opportunity to collaborate with the UNR School of Medicine on this important legislation. Thank you.
Thank you. Blaine Osborne, Nevada Rural Hospital Partners. Happy to be here in support of Senate Bill 350, particularly for what will soon be the only rural residency program at Humboldt General Hospital in Winnemucca. Thank you.
Good afternoon, Chair, members of the committee. Samantha Sato with Career Nevada on behalf of Roseman University of Health Sciences. Roseman offers programs in pharmacy, nursing, dental medicine, and graduate level programs in biological and pharmaceutical sciences. We appreciate the bill's sponsor for bringing this legislation forward and are in full support. Thank you.
Mark Ellis with Communication Workers of America, and to keep this brief, us too.
Thank you, Mr. Chair, members of the committee. Alejandro Rodriguez, Nevada System of Higher Education, and she is in strong support of SB 350 and appreciates the work from Senator Pazina. Thank you.
Good afternoon. My name's Patrick Kelly with the Nevada Hospital Association. We'd like to add a big ditto.
Barry Cole, Barrycole. Ditto as well, with one proviso. I'm an old guy, and I heard Dr. Khan say he wants $50 million for GME related to geriatric-focused specialties. I'm in favor of that because I think I'll be using them. Thank you.
Anyone else willing to testify in support? We made it, guys. We were close to the 15-minute mark. All right, let's move on to opposition. Anyone that wants to testify in opposition to this bill, please come forward. Anyone in Las Vegas? And anyone virtually?
Chair, there are no callers wishing to testify in opposition at this time.
Thank you so much. Anyone willing to testify in neutral on Senate Bill 350, please come forward. Anyone in Las Vegas? And anyone virtually?
Chair, there are no callers wishing to testify in neutral at this time.
Thank you so much. Senator Pazina, did you have any closing remarks? All right. I think we have a motion from Vice Chair Nguyen.
I'd move to amend and do pass Senate Bill 350.
Thank you so much. We have a Vice Chair Nguyen, a motion of amend and do pass, second from Senator Titus. Any discussion or any questions on the motion? Moving on to the vote of amend and do pass. All those in favor, please say aye. Aye.
Aye.
Any opposition? Motion carries. I'll go ahead and assign that statement to Senator Pazina. Thank you so much. And last, we have reached Senate Bill 348. This bill revises provisions relating to health facilities. I'm going to go ahead and open the hearing and pass the gavel over to Senator Lane.
Thank you, Chair. Please proceed when you're ready.
Thank you so much, Senator Lang. Fabian Doñate for the record, and good afternoon to the members of the Senate Committee on Health and Human Services. For the record, my name is Fabian Doñate, and I'm proud to represent Senate District 10, which is in central Las Vegas. I come before all of you to speak on Senate Bill 348, which revises provisions relating to health facilities. I'm going to try my best to make this presentation as straightforward, given I know the time limits that we have. As part of our recovery efforts from the COVID-19 pandemic, I think that many of us, including all Nevadans across the state, recognize that our healthcare workers need more support and that our health infrastructure hasn't been what we have desired it to be. The rising levels of health expenditures have led to health disparities throughout the state, and we know that our health system is very vulnerable. And so what I have proposed today is what I call a stability bill to help stabilize the healthcare delivery system that we have. Stabilizing our healthcare system is a good common sense practice that can support the continuum of care for our most vulnerable patients. Today, there are segments of the population, both in rural and urban spaces, that travel longer distances to receive the care that they need. I'm going to talk about why this bill came forward. It's important for me to be open and honest as to why we have this bill and why it came to the way it is to you. I have been very frustrated with the delivery of care in East Las Vegas. Having grown up in East Las Vegas, I believe that we need to do a better job to support services. And as a healthcare administrator, I have been in conversations with other facilities and other colleagues, and the conversation that we have always come is, especially for those of us that live in East Las Vegas, is we deserve a healthcare system just as much as every part of the city does. It's not fair to us that for those of us that live on the east side have to travel all the way across town to Summerlin for our specialists. It's not fair that our hospitals are farther away. And in the one pager that I gave you, I went to East Carolina Technical Academy, which is all the way up by the mountain. And the example that I gave was if a student were to get injured from Las Vegas High School, say they were running track and they got injured, the nearest hospital is about 7.2 miles away. This distance is significant. It can be a barrier to the student or the family if they don't have adequate access to transportation. And it's a policy like that that makes me question, if there are large distances that kids like me that grew up on the east side have to travel when there's an emergency. The issue is exacerbated, of course, if you live in rural settings. What I have before you today is a bill that addresses one thing, which is if there is a hospital closure, people deserve to know what happens. As you may know, we had a hospital closed on the east side of Las Vegas. It was breaking news, and to many of our dismay, now we have limited resources to another hospital that we can go to. That's pretty unfortunate. I believe that as a strain, we've spent many moments in this committee talking about the straining of resources and how that relates to the delivery of care. And when a hospital closes, it's an institutional change that can dramatically reduce healthcare services for many of the folks that call that county or that city their home. And so what I have before you today is a bill that starts to revise that. Senate Bill 348 aims to do the following. It allows us to join other states to create monitoring tools that can better understand and influence the state's healthcare capacity. It allows us the opportunity to identify transparency efforts that can focus on the affordability of healthcare. It can focus to reduce barriers that residents may face because of the closure of facilities and expand the role of the state to support critical healthcare access points. The bottom line is this. I think that Nevadans deserve to know that when their hospital is closing, they should know where to receive the services once the hospital closes. And as policymakers, we need to ensure that our residents and clinicians are informed of major healthcare decisions that may negatively impact or reduce the institutional quality of care. So I have a proposed amendment that I uploaded to Nallis for you all. The first portion of the bill with Section 2, as you will see, Section 2 of the bill will now divide it into two parts. So if the hospital is closing, under this bill, they would have to notify DHHS. It doesn't have set requirements yet as to when that time capacity has to be, but they would have to notify DHHS of their intention to close. If the facility itself wants to transition to, say, a freestanding ER or any other type of facility, then at that point in time, they would have to go through an application process within a 30-day time period. If you look in Section 2 of the bill, it sets out certain requirements that they have to do. For instance, where was the hospital located? Who is the owner of the hospital structure? What was the reason for the conversion, and how does that play out for the local institutions? An explanation as to why the closure is occurring. And then, of course, data regarding how the population will be impacted within the 24 months. So I think this is, the interesting point that I want to make and clarify for folks is what we don't want is a situation where the government is telling a facility whether or not they can close. That is not my intention of this bill. But if there is a hospital that closes, particularly as we experienced on the east side, I believe that the folks that should be made aware are, of course, those at DHHS, the patient population that relies on that hospital system, and the other providers that will not have to pick up the level of services that are now going to be required for the patients to be diverted. And so that is what the Section 2 amendment does. And then we've also removed the provisions on Section 3, which talked about independent centers for emergency medical care. That itself concludes the amendment, and I'm happy to answer any questions. I do have members of the Health Services Coalition to help me answer any questions that you may have, but that is the premise of this bill and why we're here today.
Thank you, Chair. Senator Nguyen needs to leave, so I'm going to have her ask her questions first, and then we'll go on to other members of the committee.
Thank you. I appreciate that. Senator Lang. I have some concerns about these freestanding ERs. I know that there's one right in the heart of Senate District 3, and I pass it all the time, and I see that it's there. And I always thought, which I think a lot of people think, that it is a true like emergency room where you can present if you have an emergency. So if someone goes to one of these facilities with an emergency and then later it is determined that they can't be treated at that emergency, are they then transported by an ambulance to another facility? And and this might be a question for the hospitals. So if it is, if I can have you answer that when you might come up here. Or you might actually know the answers to this. If they're transported by an ambulance, is it to the corresponding facility hospital that it is associated with? So, and then if that is not the closest facility for the emergency, how does that work with when time is of the utmost concern, and you already have someone presenting at an emergency room with an emergency that can't be handled at that freestanding ER, not only are we now having to transport them to another facility, but potentially a facility that's even further away, just adding to that care and that time that is needed for the medical care. So how does that working in practice? And that might be an answer that I can get from both the Health Trust as well as the hospitals, if that's possible.
Thank you so much, Senator Wynn, Fabian Doñate, for the record. So you are correct. What we're seeing now are freestanding ERs being stood up across town. There is one on the east side, but I think it's also a concern of the education of the consumer or of the patient, right? If you don't know how the healthcare system operates, if you read emergency room, you might believe that there are a whole wide range of services that are attached to a hospital. That's just the common reality for many folks who don't interact the same way that we do with the healthcare system. There are structures in place, right? We have urgent cares, now we have freestanding EDs, and then we have the emergency rooms that are attached to the acute hospital systems. And if there is instances where a patient goes to a freestanding ER and the encounter is more catastrophic and it needs to be addressed someplace else, it would require the delay of care and the transfer towards an acute facility. There are some level of services that might not be able to be taken care of right there and then. Again, I think that's important for the consumers to understand what that entails, but in terms of the data points, I think that's appropriate to ask for the other organizations, but I'll let my co-presenters if they have anything else to add.
Maya Holmes, Health Policy Director for the Culinary Health Fund, and we're members of the Health Services Coalition. I think one of the issues for us is the lack of transparency because the freestanding ERs often are not licensed separate, or they're not licensed separately, so we can't always track utilization and the spending that's happening separate. So in terms of what's being transferred and not, Stacy can talk in more detail, but we have worked through the Health Services Coalition in our contracts where our patients do not get double billed, but sometimes it can still happen and there are issues that we have to work on. But that's only us, so we can't speak to what is happening with the uninsured, what is happening with other health plans. But it's a concern that we certainly have. And I would ditto the concerns about, we do think there is a misconception of the freestanding ERs that people don't always understand when they're going into them, that this is not an urgent care. This is a emergency room with emergency room rates and co-pays and deductibles and all those things that are attached. So we do have concerns about that.
And I have another question. Again, probably for the hospitals, because it sounds like you need this bill in order to get some of this data about transparency. But do you know kind of what percentages of patients are presenting at these standalone ERs and then later being transported to a different facility? And if I'm assuming that if there is an emergency and someone presents at a freestanding ER, they're going to be taken to the closest hospital in that circumstance. I'm assuming that would be just the standard of care. But if that is the case, would that be considered 2 emergency room visits because it would be hospital X and hospital Y?
Stacy Sasso, for the record, Executive Director for the Health Services Coalition. the coalition represents 25 union and employer-sponsored health plans in Southern Nevada with an estimated 280,000 lives, stretching from union plans like Culinary Health Fund, Teamsters, all the way to gaming employers and municipalities. It is our understanding that if you are stable but require a transfer to a higher level of care, oftentimes those freestanding EDs will transfer within their system. So it is possible that you could be taken further away from your home to go to a different facility within that system. Speaking strictly for the groups that we represent and negotiate contracts for, if you are transferred within that system's hospital facilities, you often don't see a second ER charge. However, if you, in your example, if you're experiencing an emergency and you need to go to the closest facility and that is not within the freestanding emergency room system, you could see a second ER charge because different facilities, different billing, they don't track. In regards to the question on the percent of transfers, we don't have any way to track that right now because they're not separately reported. Everything rolls up to the mother hospital of the freestanding emergency room.
And I'm sorry, I know this was kind of my first entrance into the healthcare space in 2019 after I was appointed about some of these like unique, I guess, and different freestanding emergency room hospitals kind of situations. So my other question is, in talking to several like of our first responders, it's my understanding that they won't even transport people to these freestanding ERs if they are in need of a certain quality. So are they being trained on who to bring to a freestanding ER or not? And maybe that might be, I see a lot of police officers and firefighters in this room in ambulatory services. So maybe that is something that you can answer. And I do apologize in advance that I will be stepping up, but I will watch the answers. I'm looking at you hospital people over there.
Good afternoon, Madam Chair, committee members. Todd Inglesby, President of Professional Firefighters Nevada. Also spent the last 18 years as a firefighter, paramedic, and a captain in downtown Las Vegas. Yes, we have destination protocols through the Southern Nevada Health District, which dictate criteria where we can go and when we can't go, whether it be stroke hospitals, burn centers, UMC, et cetera. There is a protocol based on us trying to educate all our members within the EMS system on when we can transport to these freestanding ERs. And basically what it boils down to is anybody without a normal range of vital signs should not be taken to those freestanding ERs because they can't provide the care that they need if they are sick. If that makes
Can I ask what an example of someone that would be transported to a freestanding ER as opposed to a full standing, I guess, hospital emergency room?
So anybody that meets trauma criteria would not be able to go to that ER. Anybody who has an elevated blood pressure, anybody who has a abnormal heart rate outside the normal range of 60 to 100.
I'm sorry to interrupt, but what would go there then?
I can just tell you my experience. I've never transported anybody there. I've picked plenty of patients up from there and to take them to an ER. So I classify it, being on the streets and working in there, it's very similar to an urgent care. But we have the education in our protocols and within the EMS. I just don't know if the public has that same education of what services are really provided at those ERs.
Well, based on my questions, I don't know. So I'm imagining that this is a common problem. Thank you for those answers.
Would you please state your name for the record?
Oh, I'm sorry.
Yes, Todd Inglesby, President of Professional Firefighters Nevada. Sorry.
Thank you, Senator. I do have to step out.
Okay, thank you. Mr. Stone, do you have questions? Senator Stone.
Thank you, Madam Vice Chair. Thank you, Senator Donate. I think you bring up some very important, challenging issues that we need to address. I've always felt that these independent emergency rooms that are not affiliated with a major hospital in Nevada can kind of cherry pick the patient populations that they accept. running a hospital today is not an inexpensive endeavor. It's kind of a holistic approach where, you depend on the emergency room, which is probably a major profit center, and of course, housing patients in your hospital. So I'm looking at your section 6 of the bill, and it requires that an independent center for emergency medical care to be licensed separately from any other licensed facility. We have a number of emergency room independent sites that are a part of a larger hospital system that can obviously get technical medical supervision advice for these more serious cases that come into the emergency room. Obviously, if they go to one of these sites that has a actual relationship, they're owned by a major hospital, and if it's not an emergency, it would require that patient to go to the nearest hospital if the one that is owning that emergency center is further away. I can understand that they could be charged a separate charge, but if they are not in an emergent situation where another 10 minutes of a ride and an ambulance can get them to the parent hospital, I agree they probably wouldn't be charged, but it seems to me that we're charging an existing medical provider for 2 licenses when they really have an extension within the community that's linked to them. So I wanted to hear your rationale for those type of emergency centers, not the independent ones that aren't linked to any hospitals, but the ones that are a part of these major hospitals, and especially in the Las Vegas area.
Sure. Thank you so much, Senator Stone. Fabian Donato for the record. I'll let my colleagues as well speak to that statement. The question, that is a similar question that I came up with myself, which was, what is the difference between an urgent care and independent emergency medical care facility and an acute hospital, or an ED located in an acute hospital? And I think that's a very valid question. From my perspective, I believe we should be treating them separately. I think there are probably services that a freestanding ER can provide more than perhaps urgent care. And of course, there's a level of difference that could occur in an acute facility. As you may know, the institutions in this state have multiple facilities under different types of licensees, and so that is part of the norm if you have different types of facilities under your jurisdiction. And so it's kind of to repair that issue. I know that I'm willing to work with some stakeholders to see how that actually plays out, and as part of the conversations that we'll have after this hearing, and we hope that we can continue to work on this, but I'll let my colleagues speak to that as well if they want to. Yeah.
Thank you. Maya Holmes for the record, and thank you for the question. I think a lot of what we're thinking is this is also a newer for Nevada, it's a newer type of medical model. Yeah. So especially in Las Vegas, which we're most familiar with since 2016 with new freestanding ERs online, in the next year or so, we're going to have 15 of these, including micro hospitals. And so, this is, and, to Senator Donate's point, they have different types of facilities that are licensed differently that are still kind of within the health system world. So we think this is a new model that needs to be addressed within the licensing and regulatory structure. And it also gets back to the transparency issue of, being able to see what is happening with this, and that, the state is doing more, like with the APCD and other things, to really understand healthcare spending and healthcare growth. And when it's wrapped in, and especially when there's these issues of utilization and cost and quality, to have them separated out is helpful.
I mean, just to follow up, if I may, listen, we would love to have more hospitals in place of these independent emergency rooms throughout the Clark County, where I'm from as well, and certainly in the rural areas. But financing for opening of hospitals is a very challenging endeavor today. So I'm just trying to make a dichotomy, if you will, between these independent emergency centers that have a finite number of staff, a finite background of multidisciplinary help that can help them in an acute emergency situation with technology that we have today. I think they should be treated differently than an emergency room satellite facility that is a part of a much larger system, that they can draw on that multidisciplinary approach to make sure that when time is of the essence, that they can get that emergency consultation and do the proper procedures there. And if not, then they got to be transported to someplace else. But I just hope that you'll take that into consideration as you move forward with this bill. But I want to applaud you, Senator, because this is an ongoing issue. We've got to make sure our hospitals remain profitable, and certainly the uncompensated care that comes into the emergency rooms is a big issue for our traditional hospitals, and we got to make sure that they stay in business. And a closure certainly would be alarming, and I share your concern for seeing hospitals close. Where are my constituents going to go to get health care? So thank you for bringing this to our attention.
Thank you. Senator Titus.
Thank you, Madam Chair. Yeah, well, I found out yesterday that it's a matter of who's in the seat, and you're in the seat, so you're the chair. So, with all due respect, I understand that you're trying to do good. However, I think it's truly a misguided bill, and I think unintended negative consequences will happen with this bill, and perhaps you don't understand the actual already current different levels of hospitals that there are. And I see this as doing just the opposite of what you're trying to do. In your opening statement, you made that, we don't want hospitals closing and leaving a community empty. But at the same time, when a hospital that can barely make it, barely stay open, barely survive because of all the regulations we decide to put on them, not me, but other folks, then when somehow they try to go out in a community with a satellite system, which is less expensive than standing up a full facility where they can't get folks, et cetera, then suddenly it's, oh no, we don't want you to do that. It's frustrating as heck to hear see these kind of bills. My question is, these freestanding ERs. So for me as a provider in rural Nevada at a hospital that had an ER, a level 1, we frequently see folks in the ER to stabilize them. And I'm frustrated with our emergency provider here who testified, oh no, I don't go to that ER, freestanding ER. Our criteria, my folks, are you go to the nearest facility possible if it's a life-threatening situation. Now, not a burn center. We're certainly, there's some things that you take them to that facility or other, but if somebody's life-threatening and you're doing CPR on them, or you need to give them, they have a heart attack and you're giving them a clot buster, my gosh, you take them to our hospital in rural Nevada, and then we would transfer them to the receiving facility once we get them stabilized. Well, I would deliver a baby with somebody showing up there, get it stabilized, transfer if it needed further stabilization. So throughout our history in the hospitals here, we have hospitals because you can't afford to have a tertiary hospital everywhere in our state. But now you're asking that facilities not to have these satellite systems, and now then you complain that it's too far to the next facility. I don't comprehend how that is logical in any way, shape, or form.
Thank you so much, Senator Titus. Fabian Doñate, for the record, I think you misunderstood my intention of the bill. What I shared is that there are portions that are, there's a rationale as to why you see all the East Side legislators sign on to this bill, which is many of us have shared a frustration with the level of care that is being delivered on our side part of town. And so the portion of closures is important because if a facility closes, it doesn't matter what our philosophy is or how we view healthcare. If you are a patient and you are impacted by that, you should know where to go to your level of care. If you're a healthcare executive who works at a facility that's next door, and now these patients now have to be brought to you, you deserve to have some level of coordination. In speaking about, just imagine the circumstance where the hospital that was down the street from you, that you've gone to for 20 so years that you lived in town, is now suddenly closed. You don't know what happens to your records. You don't know what happens to where you have to go now. I think that's an important conversation. I don't have any arguments against freestanding ERs. I think freestanding ERs have a place in this community and throughout the state. That has never been the contemplation that I've shared. I think that they can provide a level of service that we can see beneficial the same way that other states have incorporated this. My rationale for the licensure differentiation is because I believe we need to start looking separately as to what the levels of tertiary care are, what services they provide differently from one another so that we can help and coordinate and plan better strategically. Because as we suffer the consequences of whether the reimbursements are low or whether the payer mix looks different from one side of town versus the other, the fact of the matter is we have seen these gaps, and these facilities have served to address those gaps, which I don't think any of us have any hesitation or have reprimanded or shuddered towards the voidance that they have filled. But I think it's also important to understand that if you are a consumer, you should understand what those different levels of care are and how that relates to your personal needs.
Follow up, Madam Chair? So thank you for that. But Senator Donate, rural hospitals have closed by the thousands throughout our nation because of costs not being able to stay open. Looking at a different model to serve communities, freestanding ERs is one option for that. And so I would just submit to you that in rural Nevada, I had a satellite clinic away from the hospital, 30 miles. I was literally the only doctor, healthcare provider, pharmacy, whatever, 30 miles in any direction. And so the average consumer doesn't understand that my little office there isn't an ER. And I didn't advertise it as an ER, but I would tell you I dropped by dead people, not all the time, but many times. Literally, people would be carrying people into my office. Oh, he passed out or whatever. I had a little satellite helicopter pad behind there, and I would stabilize these folks until we could get them to the nearest center. The reality is you go to the nearest person that's going to give you care. I don't expect the level of knowledge that folks in your community understand that. So I believe in truth in advertising. So I share your concern if you're advertised as an ER, what is that different than an urgent care? Because there are distinct differences between urgent care, and they should be advertised. So I certainly don't want you to think I don't hear that component of it, that I'm truth in advertising. But I also see that in these freestanding ERs that are a satellite to the facilities, typically if they're transporting you to their facility, their main hub, per se, they don't charge you for that transfer. Now, just like in any other situation, you go to a facility that's manned by one of these other hospitals, but that particular emergency that you have, they can't deal with at that facility. They may transfer you to another hospital. It's not the fault of the hospital that owns that freestanding ER. So they have a right to also survive. If they don't get reimbursed, they can't stay open, and then you'll have another ER closer in your community. So I know I'm pretty passionate about that. You can tell that, I'm sure. But I will tell you that I think you're well-intended, but I think this is one of these bills that has totally unintended consequences to those of us in a healthcare world that we're trying to survive when we hear every day there's not enough of us. So thank you.
Thank you so much, Senator Titus. Differences of opinion from the healthcare setting. I think that there are certain aspects of this portion of this bill that could be considered for the stabilization of services. I think that there are portions of this bill that are important, whether it's the coordination of care. As a health administrator, this would have been helpful a few months ago when Desert Springs closed in East Las Vegas. That's just a plain reality. And I share the sentiments where it's not a criticism towards the freestanding ERs that are being set up in East Las Vegas. I think there is a place for them in this community, especially if there can be extenders of what we don't have. I think in the long term, what I would look to solve is let's make sure that the facilities that do go into those underserved areas where there is a higher share of Medicaid patients, et cetera, as part of the patient population, we should look at how do we support them in the long term. And I have always shared my commitment towards that. But in terms of the actual policies laid out here, I think we should have a serious conversation as to separating them individually and how that plays out in terms of different levels of services. So that's pretty much my intention. So,
thank you for that. Thank you for the questions, Madam Chair.
A quick question here. So the hospital that closed is actually in my district, and our community was devastated when it closed because it served the needs of the community for many, many years. And I live just 2 blocks from that hospital, and I would hear ambulances all the time. Now it's a freestanding ER, and I don't hear any ambulances ever. And so I want to ask you you touched on licensing a minute ago, but I want to ask you, is there different licensing for a freestanding ER as compared to a hospital? Like, can they do different kinds, only do certain kinds of services, or... Just curious.
Maya Holmes for the record. I mean, I would defer to Mr. Robbins. Our understanding is this is kind of a gap in the licensing, and nothing here is intended to stop freestanding ERs from existing. It's to recognize that there's a new type of medical facility and there's a gap in the licensing, and we think that that should be recognized.
Yeah, so I think we're talking the same language, because I'm saying if you're trying to decide what ambulance is going to take one person to what facility, you have to know what kinds of services they're going to perform. So is there a particular kind of service that can be performed at a freestanding ER that maybe is, they can't perform something that's at a hospital under the current laws?
Eric Robbins, LCB Legal, for the record. I guess I'm not really, I'm not really sure how to answer that question. I feel like that is kind of up to the Division of Public and Behavioral Health and their regulations. A lot of that, like once you get into like kind of the nitty gritty of services being provided, that is often up to the regulations that the State Board of Health adopts and the way the division interprets those regulations.
Stacy Sasso for the record. I think if I'm understanding your question, you might be asking it in reverse. I think that there are services that, from my understanding, there are services that can be performed at a freestanding ED that also can be performed at a large acute care hospital. But I don't believe, from what we're able to track with the limited bifurcation that happens that we can see, I don't believe that there are services that can be performed at a freestanding ED that cannot be performed at a main hospital.
Okay, thank you. With that, there are no more committee questions. If you could step back, we'll go to public comment. If you're here to speak in favor of this bill, please step to the table. Anyone, and I see one person in Las Vegas, and we'll go to Las Vegas first.
Hello, my name is Victoria Partridge, SATORIA, Partridge, PARTRIDGE. I'm a casino porter, and I have been a culinary member for 18 years. I'm here today in support of Bill SB 348. I live in East Las Vegas, where a lot of freestanding ERs are popping up, pretty close to existing hospitals. We are also seeing hospitals that are being converted to emergency service facilities only. But that doesn't help me if my daughter needs to be admitted to a hospital. I worry that if I need to use one, they might put her in an ambulance to a hospital that I don't want to use. My daughter is severely asthmatic. She has flare-ups about 8 times a year that need medical attention, and she is admitted to the hospital. I have to drive about 20 minutes away to Sunrise Hospital while my baby is struggling to breathe. Did you know that freestanding emergency rooms charge the same as ERs at the hospital? We as patients learn the hard way that the freestanding ERs are not urgent care, and that they charge ER rates and not urgent care rates. I lived in Henderson in 2017, and my baby was a victim of a hit and run. She had to drive over 15 minutes to UMC because the hospitals out there did not have trauma care, but they had freestanding ERs. Nevada needs to treat freestanding ERs facilities differently and license them separately from hospitals. Nevada should also have advance notice and a review when the hospitals are closing and are converting hospitals in our community, especially when they are taking services out of our community. I asked the Nevada Legislature to more support oversight on emergency care facilities and pass SB 348. Thank you.
Thank you. Please go ahead, Mr. Catha.
Paul Catha, that's spelled C-A-T-H-A, representing the Culinary Workers Union Local 226. Good afternoon, Senator Lang, and I suppose member of the committee. The Culinary Union, through the Culinary Health Fund, is one of the largest healthcare consumers in the state. The Culinary Health Fund is sponsored by the Culinary Union and Las Vegas area employers. It provides health insurance coverage for over 130,000 Nevadans, the Culinary Union members, and their dependents. As such, Culinary Union and the Culinary Health Fund are leaders in the healthcare policy space in Nevada, and we continue advocating for patient protections, lowering healthcare costs, and increasing transparency. The majority of Culinary Union membership lives on the east side of the Las Vegas Valley and in North Las Vegas, areas that are healthcare deserts. The Culinary Health Fund intentionally located our first health center on Nellis and Lamb because approximately 40,000 culinary members live within a 5-mile radius of that location. Culinary Union members have noticed a disturbing pattern of a proliferation of freestanding emergency rooms in neighborhoods where workers live, as well as the conversion of neighborhood hospitals like Desert Springs Hospital into emergency-only facilities. Some Culinary Union members believe they are going to an urgent care but end up paying emergency room rates. Nevada needs to step in and create a separate licensing process for freestanding emergency rooms, as well as require notification when hospitals are going to be removed from working-class communities and replaced with these sorts of facilities. Passing this bill will benefit all Nevadans, and the Culinary Union is proud of its decades-long history of advocating for and winning healthcare legislation that protects the entire state and all Nevadans. The Culinary Union supports Senate Bill 348 and encourages the Nevada Legislature to support and pass this bill. Thank you.
Thank you.
Thank you, Chair. And member of the committee. For the record, my name is Susie Martinez, and I am the Executive Secretary Treasurer of the Nevada State AFL-CIO. And on behalf of over 150,000 members and 120 unions, we are in full support of the bill. Senador Doñate, I would like to thank you because I too live on the east side, so I can certainly understand the struggles of what we have to go through. I have an 87-year-old mother and want nothing for the best, not just for my mother, but for our community as a whole. Thank you, Senator, for bringing this bill forward.
Thank you.
Mark Ellis with Communication Workers of America, representing 700 St. Mary's employees. We're in full support of this bill.
Thank you.
For the record, my name is John Abel. I am the Executive Director for Government Affairs for the PPA. I'm the co-chair of Metro's Health Trust and a proud member of the Health Services Coalition. And we support this bill. And my own story is last summer I had appendicitis, and I live probably a 2-minute drive from a freestanding ER in Sky Canyon. I knew better, so I went to an actual hospital and was admitted, and I had surgery. What I worry about is our members that don't know and see emergency room and have an appendicitis, and then their appendix bursts, and then they possibly die because they didn't realize they should have gone to a freestanding hospital. For that reason, we support this bill. Thank you.
Thank you.
Good afternoon, Madam Chair, committee members. Todd Inglesby, President of Professional Firefighters Nevada. Again, we're in full support of this bill, and I'm not sure how it is in rural Nevada. Never been there, but we have protocols, catch basins that the health district worked along with the hospitals, which dictate criteria when we can take a patient to the hospital and when we can't. And I've never taken a patient there because I try not to transport patients who don't need to be transported and fall within those normal vital signs, because it is a huge cost and a huge bill for them. So that's why I haven't been there in case. So if there's any questions, I'd be happy to answer anything, but thank you.
Thank you.
Senator Lang, Joanna Jacob, Dr. Titus, Joanna Jacob, Government Affairs Manager. I'm going to ditto the earlier comments on behalf of Clark County's self-funded plan and member of the Health Services Coalition. We're in support. Thank you.
Thank you.
Good afternoon, Senators. My name is Troyce Krumie, Troyce-Krumie. I'm the current Vice Chairman of the Las Vegas Police Managers Supervisors Association. I am also a co-chair for Metro's Health Trust, and we ditto in support. Thank you.
Thank you so much. BPS, is there anyone online in support?
Chair, there are no callers for support at this time.
Thank you. Is there anyone in Carson City wishing to speak against this bill?
Vice Chair Lang, members of the committee, I had far shorter testimony prepared, but I fleshed it out a little bit to help respond to some of the questions that were asked, so please bear with me. Thank you for the opportunity to testify today. My name is Connor Kane. I'm here on behalf of HCA Healthcare and Sunrise Hospital and Sunrise Children's Hospital in opposition to Senate Bill 348. Before starting, I would like to acknowledge the sponsor for his open door policy and willingness to work with us on our concerns with the bill. Sunrise Hospital and Sunrise Children's Hospital take immense pride in caring for patients on the east side of Las Vegas. We know that the sponsor shares our desire to ensure that these folks have access to and receive the best possible health care, and we do thank him for that. With all that being said, we are here in opposition to Senate Bill 348 due to our concerns with Section 6, subsection 2. Freestanding emergency departments improve access to care by creating additional access points for patients that have emergent needs. They provide emergency department level care for these patients at a reduced wait time. Our freestanding emergency departments are an extension of our emergency departments with the same staff and capabilities to treat emergencies such as heart attacks. There are many reasons a patient might be transferred to a different department when they're already in the emergency room of a hospital. For example, a patient might need to get an MRI, which would result in them leaving the emergency department. If a patient were to come to a freestanding emergency department, instead of getting into an elevator, he or she would take an emergency transport. The patient would not pay for the transfer and does not incur an additional deductible, coinsurance, or copay. The visit is treated as the same event. If a patient meets trauma criteria, which one of the proponents mentioned, that patient would be transported to a trauma center. If a patient does not private ambulance drop off at freestanding emergency, we do have private ambulances dropping off patients at freestanding emergency departments, and we are able to accept those patients. Freestanding emergency departments have the same capabilities, same emergency department physician group staff, and same call panels. They have clinical capabilities, for example, equipment, staff, and services that an urgent care does not have. And also, for example, imaging, lab, pharmacy, respiratory, think intubation. They have the ability to operate 24/7, and urgent cares do not. When you think of an urgent care, think a place you go to get a vaccine, get a flu shot, receive an STD test. You might go there if you have a cold, minor burn, cuts requiring stitches. I've had a few of those up here. I would go to an urgent care to have that cut stitched up. Fever or minor broken bones. When you think of a freestanding emergency department, think chest pain, difficulty breathing, head trauma, something else I've had. Then you'd go to a freestanding emergency department. If it was one of my loved ones, one of my parents having a heart attack, if it's my wife who has a baby early, someone who has COVID, can't breathe, needs intubation, I'd want them to be able to get emergency care as quickly as possible, and they could receive that care at a freestanding emergency department. Less than 1% of the patients who visit one of our freestanding emergency departments went there erroneously. Again, we very much appreciate the sponsor for working with us on Section 6.2 of Senate Bill 348. Look forward to continued discussions and appreciate your time.
Thank you.
Good afternoon. My name's Patrick Kelly. I'm with the Nevada Hospital Association. We oppose Senate Bill 348 primarily because of Section 6. And we're going to be working with the sponsor of the bill to address that. There are a couple things, though, that were brought up that I would like to just address. And that is whether the freestanding emergency rooms are affiliated with the hospital. Several years ago, the legislature passed a law that required all freestanding emergency rooms in Nevada to have an affiliation agreement with the hospital, and they all do now. So you don't have these independents out there anymore. I also want you to know that freestanding emergency departments are recognized by CMS and the Joint Commission, and they're treated as a department of the hospital. And so that's a very important distinction between this level and urgent cares. And finally, I want to mention that everybody's been talking about, well, if we had a separate license for freestanding emergency rooms, everything would be different. Nothing. The consumer will never know whether you have license number 005 or license number 789, because it's still going to say emergency department outside, and the urgent care is still going to say urgent care. The licensing isn't going to tell the consumer anything. So we really just don't see the policy reason for having to get a different license. And so that's our concern. Thank you.
Thank you.
Thank you, Chair, Acting Chair, Dan Musgrove, representing the Valley Health System of Hospitals. And very tragically, the genesis of this, I think, of this bill was our facility, Desert Springs Hospital, who I actually spent time in, 5 days to be exact, and it was a great facility and a great part of that community, and it was a very tragic circumstance for the Valley Health System to even contemplate closing it, because it was an important part of our health system. It's already been said that it will continue it continues today as an ED, and then at some point we are going to build a freestanding ED next to it, and then look at somehow prioritizing, repurposing the Desert Springs facility. That's still up in the air. But, there's been a lot of discussion today about the differences between a freestanding ED, urgent care, and a hospital and primary care. And I think all of us have a responsibility, especially those that insure patients, in ensuring that they understand those differerences, because we don't want anyone to have to pay for something that they certainly didn't need. I applaud Mr. Inglesby on his role as a frontline first responder and trying to make sure that it's a last resort to transport anybody. I think that's what we all ought to be trying to emulate, is accessing primary care as often as we can, telehealth, make that phone call, and avoid going to a facility at any cost, because it certainly brings a cost. But to this bill, and again, I want to thank, as others have, the senator for his willingness to sit down and work with us. I don't think he talked about the proposed amendment, at least at this point. We would certainly like to continue talking about Section 6. But I think it's very important to understand that I just received some information that in the Valley Health System, we only transfer about 8 to 10% from the freestanding ED to our acute care facility. That's a very small percentage. And so we have tried to incorporate that front door in accessible community, in an accessible way, to make sure that people have access, as our competitors, to give them that front door that most people need. Again, we want them to use the right front door if they have to, but Desert Springs ED will continue, and it will provide that front door for that community, and hopefully only 8 to 10% of those would ever have to get moved to another facility. In fact, we have a facility very close to Desert Springs, and not to argue with the senator, but I did the mileage between Las Vegas High School and Desert Springs. It's 7.2 miles. I did the mileage from Las Vegas High School to Henderson Hospital at 7.3. I think that doesn't go to what he's talking about, and that's the need for access for all areas of the community to get the health care that they need, and we support that. And I think the previous bill was one more attempt at us bringing physicians and providers into this state that can help our citizens. And as Dr. Titus talked about, we need to make sure that our healthcare providers can survive in this state, and that means reimbursement rates, whether it's private insurance or state-run or federal-run healthcare programs. So thank you for the opportunity to testify.
Thank you. BPS, anyone on the phones wishing to testify against?
If you'd like to testify in opposition on SB 348, please press star 9 on your phone to take your place in the queue. Chair, there are no callers wishing to testify at this moment.
Thank you. Anyone on the phones wishing to testify in neutral?
If you'd like to testify in neutral on SB 348, please press star 9 on your phone to take your place in the queue. Caller with the last 3 digits, 827, please press star 6 to unmute yourself. Chair, it looks like the caller has dropped from the call. Therefore, we have no callers at this time.
Thank you so much. Anyone in Carson City wish to speak in neutral?
Thank you, Madam Chair. Katie Ryan with Dignity Health St. Rose Dominican for the record. We're in neutral today. I just wanted to clear up some miscommunication about our neighborhood hospital model a little bit too. We are just a smaller version of a hospital, so it's a full ER with 10 beds. And a number of other ancillary services as a part of it, so it's probably similar to a rural hospital. I also wanted to clear up that there is a trauma center in Henderson. Sienna campus is a level 3 trauma center. So to go against what someone had commented on earlier, it's been there for over a decade. And we have built these neighborhood hospitals specifically in places of need. So North Las Vegas, Sahara and Decatur, and a couple of other locations. So I just wanted to clear up some of that miscommunication and echo what some of my other colleagues have said about the level of care that we can provide. Thank you.
Thank you so much. Senator Nate, would you like no closing comments? Okay, thank you. We will close the hearing on Senate Bill 348, and we'll wait till the chair arrives back and begin the next.
Thank you so much. That concludes the bills that we have to be heard, but we're going to move on to the last agenda item, which is public comment. Anyone in Carson City willing to provide public comment? Anyone in Las Vegas, and anyone virtually?
Chair, the public lines are open and working. However, there are no callers at this time.
Thank you so much. That concludes the business of today, and the meeting is now adjourned.